Amy lost her first baby after reporting decreased fetal movements multiple times within 3 weeks to different medical professionals.
So those weeks really were vital in her care, and I think if we saw the same person, perhaps something could have been done.
She's one of many who spoke at a recent forum in Darwin about the importance of seeing the same midwives or doctors, known as continuity of care.
The issues that we're hearing about at Royal Darwin Hospital have been there for a long time. It's come about, I think, as a chronic under-resourcing for consecutive governments, both in the territory and at a federal level.
The organisers are local mothers who have formed the group Our Birth, Our Voice. They say chronic staffing shortages at an under-resourced Royal Darwin Hospital, made worse by the recent closure of Darwin's private maternity ward, are forcing families to move elsewhere.
You've got defence families not wanting to post here because they don't have birth choice options either.
Tessa laboured for several hours in a public tea room at the hospital because of a shortage of beds.
I obviously have got Millie and she was born ultimately safely, but some women aren't that lucky and it shouldn't be about luck.
Others spoke of the need for a safe space for mothers and fathers to grieve at the hospital after the trauma of losing a baby.
The heartbreak of losing a baby is immeasurable. The trauma of being on the maternity ward with live babies is trauma that will stay with me forever.
I was locked up at the Royal Darwin Hospital under the Mental Health Act because I was grieving. Wasn't given a space. There was no support whatsoever for my grief.
Representatives from both levels of government and the Territory's Health Department attended the forum.
Simply giving the Territory the equivalent of the average of the other states and territories would add $200 million a year to NT Health's operating budget, make an enormous difference to our ability to deliver healthcare in the Territory.
The message to the government is that we're here to stay. This is not going to be an issue that we pick up today and it's gone tomorrow. I think the chorus of voices is getting louder and louder and louder.
The federal government says it's awaiting a proposal for funding from the Territory government, in line with those received from other jurisdictions that have lost private maternity services. Felicity James, ABC News.